Prostate cancer is one of the commonest cancers in males. Usually it is seen above 40 years. We do see risk factors which can cause prostate cancer in the form of genetical predisposition. Normally, the prostate cancer patients can present with symptoms like difficulty in passing urine, or slowness in the flow of urination, or frequently passing urination, or somebody may present with blood in urine, or sometimes the patient may present with complete blockage of urine. So basically, when they come to us, we normally examine them, the patients. If at all we find an increased PSA, or when we find an hard nodule or a hardness in the prostate, we try to stage this disease. So once the diagnosis is made, we try to see whether this patient is fit for any procedure or whether we have to treat with other non-operative procedures. Basically, when the disease is very early stage, when it's confined to the prostate and the local lymph nodes, we do what is called a radical prostatectomy, wherein either we do it as an open procedure or a robotic procedure. If the patient is not fit, then we advise him to go for what is called a radiotherapy for the prostate. If the patient has an extensive disease, we may start with a first dose of chemotherapy followed by hormonal therapy. Once the treatment is given, these patients have to be followed up on a regular basis. The regular basis, the way of following is with the PSA and probably a physical examination. So based on the rate at which the PSA has decreased or whether there is an increase, then we try to restage. Otherwise, we just have to continue to monitor these patients. In an early stage, there is almost a 90 to 95% of cure rate in a prostate cancer, and even in a stage 3, stage 4 disease, quality of life, the survival rates are better than any other cancer. So when we consider any preventive measures for prostate cancers, the basic thing will be to change the diet. Ask them to be more on vegetables and fruits, which may decrease this thing. We ask them to be on a regular PSA follow-up.